Hello friends, welcome to our channel Dr. Scott. Today's our topic is clinical anatomy of head and neck part 1. Let's start with the borders between head and neck. In this we will see how head and neck are divided by each other with the borders. Okay, so let's begin with head and neck. Borders first. It is divided by meatal protuberance. Second, inferior margin of mandible. Third, angle of mandible. Fourth, mastoid process. In mastoid process, the posterior margin. Okay, whole mastoid process and its posterior margin both. Fifth, superior nuchal line. And sixth, external occipital protuberance. Okay, so let's see the diagram. Okay, here we have diagram of the skull. In this you can see the meatal foramen or meatal protuberance to the inferior margin of the mandible, to mastoid process, superior nuchal line, and the external occipital protuberance. From here, meatal foramen through the inferior margin of mandible and angle to the mastoid to the external occipital protuberance. Whole skull is divided by neck in this way from the lower margin of the skull, right? Now we will see how cerebral part and facial part are divided by each other. The borders are zygomatic process, frontal process of zygomatic bone. Let me write here. So between facial and cerebral. The first is zygomatic process of frontal bone. So zygomatic process of frontal bone. The frontal bone consists of the process known as zygomatic. Second is frontal process of zygomatic bone. So in zygomatic bone there is a frontal process also. So second is divided by frontal process of zygomatic bone. Frontal process of zygomatic bone. Okay, the third is zygomatic arc. Fourth is external acoustic meatus. Fifth, anterior margin of mastoid process. Here we have posterior margin of mastoid process. Don't confuse with the anterior and posterior margin of mastoid process, right? In head and neck, the borders will be posterior margin. In facial and cerebral, it is anterior margin of mastoid process. Sixth, apex of mastoid process. Okay, here look, it starts from the frontal process of zygomatic bone. Here we have the frontal process of zygomatic bone. Here we have zygomatic process of frontal bone to the zygomatic arch, to the external acousticus meatus, to the anterior margin of mastoid process. Here we have a mastoid process to the apex of the mastoid process till here. From this inferior margin of the cerebral part, it will divide skull and facial, right? Now the cerebral part is divided into three regions. Now we are talking about cerebral part. Okay, cerebral part is divided into three regions. The first is fronto-parieto-occipital region, fronto-parieto-occipital region. Second, the temporal region. Okay, and the third is mastoid region. Okay, these three are cerebral region. So here we have looked this from fronto-parieto-occipital. Let's break down it. Fronto means frontal bone, parietal means parietal bone, and occipital, the whole upper part, is known as fronto-parieto-occipital region. The second part is mastoid region. Here a small area known as mastoid region, and the third is temporal region or temporal bone. So it consists of three parts: temporoparieto-occipital, temporal, frontoparieto-occipital, temporal bone, and mastoid region. Okay, now let's talk about the frontoparieto-occipital region. Okay, frontoparieto-occipital region. So it consists of borders and layers. So first we talk about the borders. So it divides from the facial by anterior, posterior, and bilateral. Bilateral means both two sides of the lateral part, right? So anteriorly, glabella and superior orbital margin of frontal bone, right? Posteriorly, superior nuchal line. It's a part of occipital bone, right? And external occipital protuberance. It's also a part of occipital. Both are the part of frontal, right? And bilateral, superior temporal line. It's a part of the parietal, right? Here you can see that here we have glabella, right? Here we have superior orbital margin. From here we have this superior nuchal line of the temporal bone, but it divides temporal and parietal. And posteriorly we have superior nuchal line. It will from here to here, and the external occipital protuberance, right? Now the layers. Second is layers. So first layer of the frontoparieto-occipital is skin. Second is subcutaneous tissue. Third, superficial fascia. Fourth, subaponeurotica, fatty tissue. Fifth, periosteum. And sixth, the last, bone. Right? So there are 6 layers in frontoparieto-occipital region. Skin is a loose and less movable, but it is a movable, right? Subcutaneous tissue. It consists of nerves and vessels. The vessels like supraorbital veins, frontal veins, superficial temporal vein, posterior auricular arteries and veins, and occipital arteries and veins, right? The periosteum, superficial fascia, it's connect galea aponeurotica. Glaria aponeurotica. It's the muscle of the whole frontoparieto-occipital region. Now periosteum. What do you mean by periosteum? Osteum means bone and peri means covering. Covering of bones known as periosteum. It is loose connective connected with the bones. And the most important thing, it consists of hemorrhage. What is hemorrhage? It's a accumulation of a blood. It's like a clot on the area of the bones on the in the periosteum. It's a accumulation of blood. Accumulation of blood, and it can be spreaded in any direction. It is not fixed that from right to left or left to right. It can be in any direction of the bones, right? Bone, frontal, parietal and occipital, but it consists of a important vein which is known as emissary vein. It consists of emissary vein, and it consists of three important layers, right? The first is external lamina. Second, diploid. It is a vein. It's not a layer, but it's a vein, right? And the internal layer or internal lamina. The another Latin name of the internal lamina is known as lamina vitrea. Like here we have a diagram on fronto-parieto-occipital. Here you can see the skin. This yellow color is known as skin, which consists of hairs, right? Then it consists of superficial fascia, which consists of bloods and blood vessels, like I said before, supraorbital vein, frontal vein. Okay. The third layer, this one is first layer, this one is second layer, this is third layer. Epicranial aponeurosis, it is a muscle, right? Then fourth, loose connective tissue, right? Which fifth, pericranium. Sixth, diplodoctic vein, okay, the layers of the bones, and then dura it continues with it. Here you can see that superior sagittal sinus, which consists of a vein known as emissary veins, and it consists of diplodoctic vein and the bone. Here you can see a bone which consists of outer skull, which is known as external lamina, inner skull, which is known as inner lamina, and the diploid vein. Like this, it makes three layers, right? Then pericranium or pericranium or periosteum, and here is the whole diagram of the layers of the skull. Here you can see I have written SCALP, right? S consists of skin. C, superficial fascia plus blood vessels. It's C because it is connective tissue, right? Then A, aponeurotica. A. L, loose connective tissue, which consists of L. And P, pericranium or periosteum. Here is a mnemonic of the scalp of the fronto-perioccipital region. Here in this diagram, you can see the regions of the face. Like this region is known as regio frontalis, regio temporalis, regio orbitalis, nasalis, infraorbitalis. Now, the important is regio occipitalis, regio parietalis, regio temporalis, and regio frontalis. Region, right? In Latin, it is known as regio. After completing the fronto-parieto-occipital region, we will go to the second region of the cerebral. So let's begin with the temporal region, right? Temporal region. It also consists of borders and layers. So let's begin with the borders, right? The anterior, superior and inferior. It consists of anterior, superior and inferior. Anteriorly, it consists of zygomatic process of frontal bone, frontal process of zygomatic bone, superior temporal line, and zygomatic arc. Here let's see in the diagram. Here this is a temporal region, right? It consists of frontal process of zygomatic bone, zygomatic process of frontal bone, and the zygomatic part, zygomatic arch, and this is a superior nuchal line. Here you can see a superior nuchal line. This is an inferior nuchal line, right? So let's begin with the layers. It consists of different layers than that of fronto-parieto-occipital region. So first is skin, the most common region, layer. So it consists of lot of sweet and sebaceous glands. Second, subcutaneous tissue. Third, superficial fascia. Fourth, deep fascia, one of the important layer in the temporal bone. Fifth, muscles. Sixth, periosteum. And seventh, bones. And seventh is bones. So skin, it is inward in insertion by two nerves. Consists of two nerve insertion, auriculotemporalis nerve and zygomaticotemporalis. How you remember this nerve? You know, the in the borders you can see the zygomatic process, so related to zygomatic, and which bone we are talking about? Temporal bone. So zygomatico-temporal or zygomatic temporal nerve. The second, in the area of the temporalis we can see auricle, right? So auriculotemporalis nerve. So these two nerve are inward insertion in the skin. Then second is subcutaneous tissue, right? It consists of one artery and vein, which is known as superficial temporal artery and vein. So superficial, we are talking about temporal. Superficially there will be superficial temporal nerve and artery and vein, okay? And the nerve is cutaneous nerve. How we will remember this nerve? By the layer. You know this layer is subcutaneous. Remove this sub, we have cutaneous, so it is cutaneous now. So you will remember this both artery and nerve. Then we have superficial fascia. There is a good controversy in superficial fascia. We can see a galea aponeurotica, right, which is the muscle, right? But in deep fascia is also known as temporal aponeurotica, right? So superficial is glea and deep is temporal. How we will remember this both? By glea is superficially whole in frontoparietal and occipital, and temporal, right? Temporal small amount, and deep fascia, how will we remember it is called temporal? Because we are talking about the temporal bone. That's why this part is known as temporal aponeurotica. Then temporal aponeurotica consists of two lamina, external and internal bones. It also consists of two lamina, external and internal. So how we will remember? External, internal, no big deal. Now it also consists of two lamina, external and internal. So how we will remember? External, internal, no big deal. Now we will talk about last region of the cerebral part, is known as mastoid region. right? Mastoid region. First, we will talk about portals. Anterior, posterior, superior. Okay. How will we will remember these borders? It's easy. Do you know that here we have written where it is here posterior margin. Here we written anterior margin, right? So it both are mastoid process, right? So here we are talking about mastoid region. So you can easily remember anterior part, anterior region, posterior part, posterior region. It's easy, right? And superior part, zygomatic arc. As you can see here, this is a mastoid process, right? Here it's a continuation of the zygomatic arc, right? Exactly, we cannot say that it's a zygomatic arc, but it's a continuation. So we can say zygomatic arc, right? Now layers. As usual, the first will be skin. Second, subcutaneous tissue, right? Third, superficial fascia. Fourth, deep fascia. And fifth, bone, right? Skin. It is inverted insertion by two nerves, great auricle nerve and lesser occipital nerve. How we will remember this? First thing, mastoid region. It's a part of temporal bone. Temporal bone contains which like now auricotemporalis, aurico, great auricle, right? But both of these are a part of cervical plexus, right? Just remember this, they both are the part of cervical plexus. And with the mastoid process we have lesser occipital. Now you have to just mug up things, right? And the important part of the deep fascia of the mastoid region is it covers SCM, scledocleidomastoid, sorry, sternocleidomastoid muscle, right? So how will we remember this? Mastoid. Anything related to the mastoid, it will be the part of the mastoid region, right? So what is difference between all the layers of this is you can see here. Let's talk with the fronto-parieto-occipital. It consists of skin, subcutaneous, superficial fascia. Is these three are common in all the region, like you can see a temporal region, where it is, yes, skin, subcutaneous and superficial. Skin, subcutaneous and superficial. Let's do another color, right? Then the third, then bone is common, bone is common, bone is common, right? But here you have to remember subaponeurotica fatty tissue and periosteum, right? Periosteum, it's easy for you, right, to remember this. In temporal region you have to remember deep fascia, periosteum and muscle, right? Muscle, it's logically, you know, if there is something region related to the fascia there must be a muscle. So muscle you can remember easily. In temporal and mastoid region both contain superficial and deep fascia, superficial and deep fascia. So it's easy to remember the three of this region. The last topic of this video is Cypher's triangle. Yes, Cypher's triangle. So it consists of anterior, superior and posterior. Anteriorly it is external acousticus meatus. Posterior margin of the external acousticus meatus. Superiorly root of zygomatic bone. Here you can see this continuation of the zygomatic bone. You can see. That's why in mastoid region we will see the zygomatic arc, right? And the posteriorly zygomatic, mastoid process. So here we have all the diagrams. Wait, look here. You can see the difference. from the mandible foramen, meatal foramen to the angle of the mandible to the mastoid process to the occipital, different by the neck. Okay, now the cerebral and facial by zygomatic process, zygomatic arc to the mastoid process, anterior margin of the mastoid process, from the facial to the posterior margin of the mastoid process, from the cerebral to the facial. Now three regions, fronto-parieto-occipital, temporal, mastoid region. It is divided by anteriorly by the this zygomatic process and zygomatic frontal process, right? And this is my third process. Here we have the three region, right? And here you can see the anterior view with the glabella, supraorbital margin, right? And the these two processes and the superior neutral lines of the temporal bone. So for today this is it. Hope you like the video. If you like, then please hit the like button, comment in a comment section for our new topic, and please subscribe it. And it consists of bell also, so please hit the bell button. And thank you for the watching. Goodbye.